Hello friends, hello friends, hello friends, hello friends, hello friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. ULA's mission and vision is to support, educate, and promote union labor in our communities. There are great careers that you can have within the building trades as well as public sector unions. We're here to shed light on those opportunities, what they're doing, what these jobs are all about, and highlight them across the ULA's platform. Oh, we're going live now. All right, 5, 4, 3, 2, 1. Hello, friends, and welcome to the Union Labor Advisory Network podcast, the platform where we celebrate the leaders, innovators, and everyday champions, strengthening union families, building economic opportunities, and protecting the unionized workforce. I'm your host, Mike Fina, if you haven't met me before. And today's conversation truly captures the heart of the labor movement, family, service, and purpose. Our guest grew up in a proud union household, built a career serving working families, and today is helping transform healthcare for union members across the country. Joining us today, Mary Fogarty, National Taft-Hartley Liaison at Solidaritus Health, a labor-owned healthcare organization built to deliver better care, lower costs, and real solutions for union workers and their families. So Mary, welcome to the ULA podcast.
Mike, thank you so much for having me here today.
Absolutely, absolutely. This is fun. I mean, this is
great. This is great.
This is great.
I love this.
So, Mary, let's get started with your roots. I mean, again, I know you for quite some time, but you grew up in a union labor household. What was the experience like, and how did that shape the values of your view of the world today?
You know, I was born in the city. My father was a 580 iron worker.
Yep.
So, honestly, I kind of thought, like, this is how everybody lived, right? Like, this was the
norm.
The norm, right? Everybody, so my whole family were iron workers. If they weren't iron workers, it was sanitation, it was police, it was fire. Everybody was friends with somebody in the union. So I really thought that, like, that was how the whole world lived. And it really wasn't until I got a little older and realized what an opportunity it is to be a part of a union family, to be a part of the union movement, and the opportunity that it gives people that most people don't have, right? And it really, truly is the pathway to the middle class for people.
And you know, for my past 25, almost 30 years in labor, you know, I've been very fortunate to meet so many different people within labor, understanding the values, the fight, the solidarity, the opportunity, the family that you really obtain as, you know, just being in this particular space for so long.
Yeah.
So it is a privilege, and I'm proud to be able to, you know, for most of my career, work within this space to support organizations that fight for others, for their best interests, for their benefits, for fair wages and their salary, and also the training and opportunities that you have, especially in today's world where the construction industry, it has a lack of skilled, tradespeople, and now is the golden era of, like, the revitalization of some of these vocational career opportunities. So I'm just, like, you know, having the understanding of, and the privilege of going through all these training centers, and now knowing that this is, like, the next generational opportunities, it's, like, incredible.
Yeah,
I'm pumped.
It really is. And, you know, the generation that my parents and my grandparents came from, there really wasn't that opportunity, right? Number one, we're Irish. So that was a struggle in the city back when everyone first came to the country. And then also growing up like that, so realizing that college really was not an option. It wasn't even talked about back then. So most of the people that I knew, or, you know, in my family, left school, some of them before they graduated school, and ended up, you know, still being able to achieve the American dream by having a home and being able to raise their family and having benefits. And like you just spoke about the struggles. I mean, I remember as a small child, you know, overhearing or listening to the adults talking about, you know, the layoffs or the non-union coming in, the struggles that were there within the unions. So there was so much that the labor movement has achieved that I believe people now, like you're talking about an unskilled labor force, that they really need to bring it back and teach these kids that college is not the only option. Of course, it's a great option, right? And education is always good, but that's not the only way, and that skilled labor is still such a necessary thing in the world we live in today.
Yeah, and it's not even and or, you can have both.
Yes.
And the training, these apprenticeships today, there's accredited credits that can go towards your bachelor's. So you're getting firsthand a skill that you could take anywhere.
Yeah.
Again, I wish I could do it because I can't hammer a nail and everything's electric today. I know we had some conversations with some electrical unions today. It's these data centers and everything that's going on. There's such a need for skilled labor, and I'm just excited to be part of some of this, like this reinvigorated, build out of the workforce that's happening. So it's really cool.
Yeah, it really is. And speaking of the electricians, so carrying on the family tradition, my youngest just joined Local 25 IBEW. So that was a proud mama moment too, that we have this continuation of labor in the family.
Well, you know the benefits and the values of it.
Of course.
So it's like, why not? A lot of times everybody's like, it's all nepotism. Well, if you know there's a real career, how can you not steer your child or your family to go into that?
Of course, and friends, and like we were just talking to Kevin Casey about, the kids in the community are up and coming, and they're getting into the labor movement. So it's really such a good change that I see happening as far as the young people go.
Yeah, absolutely, and that gets me excited because we talked about my background in banking before I got into our world of media. The cash flow in any organization, it is in its membership, and the strength of that, the dues paying members, but just, membership strength drives those opportunities. And in this world today, if we can inspire, educate, and promote what these career opportunities can look like and drive people to these particular careers, then I know I can have a really self-fulfilling, life and career in doing what it is that we do today. So it's awesome. It's really
great.
cool.
Really
and now we got this podcast studio.
I love
we got
it.
Things rocking and rolling right here. I do have a couple questions for you in regards to Bob says. When did you realize how powerful unions are in protecting families and building opportunities? And again, we talked about with your family, but in today's world as well. Again, you're a provider, really supporting a lot of benefits as well. But these are some of the strengths I think that organized labor provides.
So, what we were talking about is as far as being able to give people the opportunity for home ownership. Let's not forget, right? When I was up and coming, it wasn't an option for me to become an iron worker, right? All the men in the family were iron workers or, in some sort of labor, but, the women in the family weren't going to do that. So now there's opportunity for young women to join the labor force. And, how many women attended the Women in Labor Conference?
It was almost like 6,000. Yeah,
6,000 women. So, just the changes that are there as far as that goes, and the opportunity that it affords for people to become part of the community, right? They have better benefits. They can talk about retirement. They can talk about all of these things that were not available before.
Yep.
And the education that comes with it. The brotherhood that comes with it, the work ethic that's learned about it, and sisterhood, I should say. Yeah. But, the work ethic, learning from the people who have come before, right? The older generation, the trainers, the apprentice schools, offering opportunity to the less fortunate, right? And being able to provide something that they may not otherwise have. And labor needs to be that vehicle for people to change their lives that way.
Yeah. And, again, I've been very fortunate and blessed over the course of my career to go through these training centers and see these are universities within these labor organizations. I mean, this is continuous training throughout your career that you have access to as a member. Just like your gym membership, you got to utilize it and take advantage of it and get all those necessary certifications because that helps elevate your career. And, you are mobile. You have the opportunity to move. It's how well do you want to get yourself trained and how hard are you going to work and how you're going to use your network and give back. And again, we talked to John Guadagno earlier today as well, and all the community service work that he does to give back and support, community development because their members live in their community. And now as they are skilled to be able to support and beautify their communities and make things work well, it's just a really nice ecosystem or connection that that we have in the labor space. So it's just really good.
And they can continue learning, like you said. And again, college is amazing, but college is expensive. And if they're in an apprentice school or they have the ongoing training, they're being paid to learn.
Yeah.
So they're not coming out with a lot of debt.
Yeah.
They're actually earning while they're learning. So it's
we got to talk. Yeah, exactly.
Yeah.
Absolutely.
Yeah.
And now you have some of the CUNY universities that know with the New York State Building and Construction Trades have started to partner up with the universities. So now if you are in college and you want to get your accredited or understanding about what the vocational careers could look like, you have access to be able to do that now.
It's amazing.
And I didn't have that. I went to Catholic school, so I didn't have shop class. And fast forward now, you're looking at all these different things that are out there. It's like, wow. I could have been in a whole other career path.
Yeah.
If I know. Me growing up, it was like finance. You want to be a stockbroker. So that's the career path you go into finance. And then you had some other friends that were cops, court, firemen, carpenters.
Right. Same. Of course.
And fast forward, I'm a little bit older now. People looking to retire. You got some of these guys that were in the trades that got a pension, and they're done. And now they're doing their secondary, love of what it is that they want to do after their career.
Yeah.
And they have all the skills. They could be making bird houses or benches and selling stuff on Etsy and doing different things and have another set of revenue stream that come because they have a skill set and a connection with their community and their union local and their brother and sister that's out there. So it's really cool.
Yeah, it's great.
I'm a super advocate. I get all excited about even talking about this.
Me too. Yeah.
So talking about career and calling. So you've spent over 25 years working alongside unions, labor organizations, and first responders, particularly around wellness and behavioral health.
Yes.
What drew you into this work, and what challenges did you want to help solve?
So my entree into this work was, I'm just going to say it, right? So January 12th will be 40 years that I had my last drink or drug. I struggled with addiction and alcoholism myself, and so was blessed to find sobriety at a very early age. I was 3. No. But at a very early age, I was blessed with the gift of sobriety. That gave me a chance to then become the mother, the daughter, the community member that I needed to become. I raised my children, most of them, and entered into the behavioral health world of the trades back in late 2006. So yeah, like 20 years, it's going to be 20 years. And I actually entered in through rehab, right? I was working as a marketer for rehab, and I realized that the trades really needed help as far as contracting goes, as far as the costs go, as far as the recidivism rates go. Unfortunately, and we don't totally know the reason, but the trades have a very high percentage of people with addictions, mental health issues, behavioral health issues. And so being able to have that insight personally and understanding at some point how, like, I hate to call it the system, but it has become like the system, how that works for shareholders, for owners, for insurance companies, for all of those things, looking for the opportunity, and I did some work with the iron workers, looking for the opportunity to offer the trades a better pathway to support their members, because as you know, it is a brotherhood and sisterhood, and the most important piece of the union is the member, right, and their families. So taking that work from marketing for a treatment center, moving into members' assistance, and doing that for several years. Had a wellness center for a little while, and then COVID came, and things kind of came to a halt like everyone else. And then I was offered the opportunity to become the national Taft-Hartley Liaison for Solidaritus Health.
Right.
So Solidaritus Health is a labor-owned healthcare company anchored in advanced primary care. And I was a little bit kind of like, okay, let's see. So physical health, behavioral health, can we meld these two together and make it whole person care? And what does this provide for the trades? And that was how I came to be here today.
With Solidaritus.
Yeah, with Solidaritus.
Again, it's full circle because I've known you back in your members assistance program days. And again, that's such a big issue with the building construction trades and public sector groups.
Yeah.
When we talk about, and it's a wear and tear on your body. I mean, the trades are that you got to be a special breed. This is a special, there's multiple trades. Some are harder on others' bodies.
Yeah.
But, with that wear and tear comes, medical issues and things of that nature,
Sure.
and then painkillers and things, though. You could see the opportunity or the snowball effect that it may happen.
Yes.
So I think what's the statistic? 6 or 7 times more likely to be into I guess substance abuse if you are in the trades, or even suicide awareness type programs that are out there.
Yeah.
So to have those particular programs and have labor really focus on that and put those programs together for the better benefit of the member, their livelihood and their families, is so imperative, and it's just a special thing that they do. Just knowing that issue is there.
Yeah.
And the stigma that was around that in the past, I think, has changed.
Yes.
And even now, look at today, 2026. There's such a bigger push. There's different resources. There's different plugins. The trades are doing different things to be able to reach those members and nip it in the butt early before things get even worse.
Yes.
And I'm sure you could explain some of those things that go on as well. But I'm just proud to be part of it and be able to disseminate some of the resources that are out there, because there's so much that's being done, and it's just making sure that people are communicating the resources and taking advantage of it.
Yeah, absolutely. And what I will say about the trades too is that I don't know. I mean, I've been in the recovery community, like I said, for about 40 years, and I don't know if there's anything like the trades when it comes to the support and the care and the removal of the stigma and the support for people who are in recovery to maintain their recovery, keep working, keep being there for their families. And the trades have come so far as peer support goes, as far as labor assistance goes, as far as members assistance goes, as far as providing benefits, the medical benefits that people need to begin their recovery if they do need inpatient care, if they need outpatient care, and then the continued support within the trades that has really come to the forefront. And I know that the city building trades has been instrumental in bringing this forward and removing the stigma. I know that the Long Island building trades, Nassau-Suffolk building trades has, right in the building, there's an employee assistance professionals. So the trades have really come so far as being able to provide support for people. And the percentages are about 18 to 19% of people, which is higher than the national average. Wow. That need help.
Wow.
For all the reasons that you said.
Yep. And then it's getting people together like us too,
Mm-hmm.
and providing those resources and making sure they're educated and just being involved as we can. And as you look at your career now, as you've transitioned into Solidaritus, maybe you could elaborate a little bit more about what's going on in
Sure.
today's world, what you're going to be doing,
Sure.
and how you're going to be supporting labor in a bigger, broader way.
Yeah. So I became aware of the struggle that the health and welfare funds have as far as costs go through the behavioral health side, right? There was a lot of unscrupulous billing. There was a lot of overbilling. There was a lot of contracts that were there that cost much, much more than they should have. So that was my first real insight into the struggle that the health and welfare funds have, especially the self-funded ones. They also have the best benefits around, right? They've got the best negotiators. They've got the best benefits. They've got, all those things that people need. However, we all know what healthcare is like in this country and in the world right now, and everyone is struggling. Solidaritus is owned by labor. In 2017, there were 16 Taft-Hartley pension funds that invested into Solidaritus. That came out of a not-for-profit called America's Agenda, which is a board of labor leaders from the internationals that have been working for 20 years to figure out how to help the self-funded unions and the unions better maintain their costs, provide better benefits, and provide solutions for the self-funded unions in particular. So, like I said, Solidaritus is invested in by labor, governed by labor, and will always continue to be owned by labor. The Solidaritus difference is there's no private equity. Labor owns it and benefits from it and saves their funds money from it. So it's very different where there's no investors that are looking to drag all their profits out of it, to drag all the goodness out of it, and, just kind of give the members what's left.
Right.
So that's where Solidaritus really came to be. So began on the West Coast, like I said, in 2017, and has moved to Oklahoma and Wisconsin. And we've now begun, mostly through the Nassau-Suffolk building trades, we've gotten a jump start as far as being able to work with the building trades to be able to start an advisory board first back in April. And now we are looking to start building out probably in the springtime with a coalition of self-funded unions on the island, now moving into the city, Westchester, Hudson Valley, Jersey, and the boroughs. So we're moving forward.
So in advanced primary care, if you elaborate a little bit more on it, so that these are like the, I guess, doctors' offices that are specific for membership, so they have their own
Yes.
medical center that they have the opportunity to go to?
The trades have their own medical centers. They have their own doctors. This has never happened before. This before has only been available for the wealthy, for the wealthiest people around. So what Solidaritus does is we provide a doctor that works for Solidaritus, right? Solidaritus works for the funds. The doctor works for Solidaritus. What happens is the doctors have no more than 1,300 patients in their caseload. That enables Solidaritus to be able to provide same or next day appointments. It enables us to do many, many procedures that would ordinarily be done in an ER, in an urgent care, maybe in a dermatologist office. But what we have found out is that 85% of ER visits should have and could have been handled in an advanced primary care. That's the first way we save the fund's money. Secondly, 72% of urgent care visits can be cared for in an advanced primary care setting. What has happened is people have begun to use the urgent cares and the ERs as their primary care physician. So now you're seeing a doctor who has no idea who you are, has no idea about your history unless you tell them in the 3 minutes that you get to see them, right? After you've waited, even in an urgent care now, you're waiting for quite some time. So this is a real VIP care for the trades. It's owned by the trades. It's for the trades and their family, and there's not anything like it. Yeah.
It's really, again, that's VIP treatment.
It's VIP treatment. And historically, so far, the funds that Solidaritus is servicing right now at our other centers have saved anywhere from 5 to 41% on their overall net spend. So that's after the cost of Solidaritus. They've been able to save those numbers in their health and welfare fund over time.
I'd like to take a moment to thank Feldman, Kramer, and Monaco for all the support of the Union Labor Advisory Network and the ULA Network's Charitable Foundation. We appreciate your sponsorship and support. Thank you. What other than the members having to go to or having the ability now to go to the primary care, it's not changing. You're not changing your insurance providers, are you? You're not doing anything.
You're not doing anything. You're not changing your insurance providers. This is a per participant per month fee. There is zero claim to the fund. There is no copay. And the major way that the savings occur over time is wellness. Right now in the United States, we have sick care. We don't have health care. We have sick care. Our doctors are first of all paid prevailing wage, obviously, right? Because we're a union-owned company. So our doctors are paid prevailing wage. They get to practice at the top of their license. They're family care practitioners. They can care from pediatric to adult. And they're bonused on people's wellness, on people's consistency, on people's maintaining their diabetes care, their heart disease care, all of those things. And all of that preventive medicine is what's saving, first of all, lives, number one, right? Saving the membership, saving their families, and saving the health and welfare funds money down the road when you have catastrophic illnesses. You know, God forbid, catching cancer at a very early stage, catching heart disease before it becomes, you know, a lifelong issue, diabetes, all of those things, kidney disease. So it's really flipping the way care is delivered and the way long-term care is maintained. So this really, Vinny Alou from Local 66, he's the business manager, he has said, and he's given me permission to quote this, you know, this is a revolution in healthcare for the trades. This is going to change the way care is delivered for the building trades.
Yes. I mean, I could see it.
Yeah.
And again, you're building the facilities unionized, so like
Of course,
you're
there's a
packaging
PLA
things
on
up,
every
there's
project.
PLA on every project, so they're building out these specialty centers. How big are these centers now? What's their like?
So the minimum that we need is 2,500 square feet. Maximum is about 4,000 square feet. I know that a lot of the trades are already talking about, you know, putting a building right on their own property, you know, all of these things, because let's not forget, right? As someone who grew up in the trades, my father, my uncle, my cousin, I built that. I was on that job. I built that building. This is us, you know, I mean, I have pictures of my father, you know, on the World Trade Center. I know a lot of people do, but I mean, I have pictures of that. My cousin worked on the Twin Towers, and then my cousin worked on the Freedom Tower. So he signed his name, my father's name, my uncle's name on the last beam that the iron workers put up on the Freedom Tower. So, you know, they have pride of ownership. This is theirs. They can say to their families, hey, you know what? We're going here because we built this. This is ours. The trades own this.
Right.
This belongs to us. This is, you know, here for us. It's here for our families, and we built it. We own it. This is ours.
That's great.
Yeah.
I was talking about that earlier today too. It's just the pride that people have, you know, being able to showcase what they've built in some major. I mean, listen, we're in the Mecca. We're in New York City. You know,
Right.
the area.
Yeah.
Predominantly, you know, again, probably the highest density of unionized labor as well. One of, and you know, seeing Manhattan skyline and knowing there's a lot of union members that built that.
Yeah.
You see it all over socials right now too, as they're developing stuff like 270 Park and
Oh,
JP Morgan
amazing.
Chase building, which will be there, you know, for the test of time as well. Really cool stuff.
Really cool. I remember I actually told this story at the building trades, but I'll tell it again, right? Because it's really about what Solidaritus is and that the legacy that it will become for the trades. And that is, I grew up out east. My father commuted to New York City as an iron worker, right? So I could grow up out on the island. And my grandparents were still living in the city in Yorkville. And so I was going to pick my grandfather up, right? He didn't drive. I was going to pick him up and bring him out to the island. And my daughter, who's now a grown woman with her own kids, but she was in the back seat, in the car seat, and we were going over the bridge. And it was a beautiful, like, evening, you know, like just kind of dusk when the city's all lit up and it was a clear night. And I'll never forget, she was probably about 2.5 or 3 years old. And she looked out the window and she went, Mommy, is that the kingdom Poppy built? You know, so all of those things are what Solidaritus is to the trades. It's a legacy that will really, like Vinny Alou said, revolutionize the way healthcare is delivered to union members and their families. It can be an organizing tool. The money saved can be used for target funds, can be not the double-digit increases that they're facing. every time they go back to negotiate their health care.
Right.
What if, God forbid, they said to their members, hey, you know what? You're getting another $1 in your pocket. You're getting another $2 in your pocket because we've saved X amount of dollars on our healthcare spend.
Right.
So it's the pride of ownership and the savings that it can provide to really, really make a difference.
Yeah, and listen, large membership group organizations that have the body count understand, their expenses, again, because they're paying, these,
Sure.
these funds to be able to have one centralized or multiple facilities to go to and not have to go to the urgent cares.
Right.
Or like you said, the ERs just
Yeah.
for a general. I've done it,
Of course.
I
I have
walked
too.
up the block. I couldn't get my primary doctor. I go, let me just go over here and get tested. I don't know what it is.
Right.
The world of COVID, people are just going there like a regular.
Oh, my
amount of
gosh.
money those places, probably pulled in. If you look at the records, probably,
Billions of dollars.
Billions.
Billions of dollars, right. And let's not forget, right, the middle class is supporting all that.
Yeah. Yep.
Absolutely. Supporting all that. So this is really a major, major change for that. All of our testing is only pass-through costs. We have deals with the labs. So the fund only pays what we pay. Same with prescription drugs. We take the 50 to 150 most prescribed drugs and pass those through at our cost to the fund. So it's really such a great savings. Such a great savings.
Well, so it's a different way to look at traditional healthcare in
Right.
today's world for groups of large membership organizations or the coalitions that you can create
Right.
to support these particular initiatives.
Yeah.
You run the numbers. It makes sense.
Sure.
Here's the ROI.
Yeah.
Make it happen.
Yeah.
And labor moves slow, but there's a lot of moving parts that anything that ever happens. We all know this.
Right.
But when there are test cases that prove these particular numbers and that they do work,
Yeah.
then it's just progressively moving forward with some of the new advanced primary care facilities, technology that's enhanced, that's driving down operational costs as well.
Sure.
I mean, that's where I see a lot of the stuff. It's the technology, that you're able to oversee all that spend, and how do you do it better?
Right.
How do you, not reinvent the wheel, but enhance it.
Right.
And now that you have these particular programs, it's only going to be, onward and upward, hopefully to, see the benefits for those members.
With you saying that too, as we build these coalitions out, right? National Suffolk Building Trades has the first coalition. So the way the coalition works is because of the geography that we all are in, and let's say the city trades, everybody lives on the outskirts of the city or in the boroughs or whatever it might be. The way it's working is everyone gets a membership card. If their local is participating, they all get a membership card, okay? Heaven forbid they get injured or they're not feeling well at work and they're working in Queens, but they live in Suffolk County. They can leave the job in Queens and go to a Solidaritus in Queens. Now, even though it's not your doctor, we're leaving room in the schedules for urgent care visits. So even though it's not your doctor, Solidaritus still has all of your information. So the doctor that you're going to see and have time with to tell them what's going on can see everything that's in your file because it's all one system. So they see that you have your benefit. There's no copay when they walk in the door, right? They'll be able to be seen soon by a doctor. And you're also not walking into a crowded waiting room. The doctors are waiting for you when you get there.
Wow.
It's a completely different way of having healthcare delivered to the member. Imagine the doctor's waiting for you and you're seeing a doctor. Now, let's say in the middle of the night, you have a little one that wakes up with an earache or whatever it might be, right? Not feeling well, and you think, oh my gosh, do we need to go to the ER? We have 24/7 virtual care.
Okay.
Also, the doctor answers the phone. Okay, if he says, you know what, you do need to go to the emergency room, that's still a doctor telling you that, right? If not, he says, you know what, you can go to your local pharmacy or we can send it over, whatever it might be. Now, if you're in one of the Solidaritus offices, you can leave with your prescription should you need one.
Wow.
They're right there in the office.
I can't wait to see him.
I know. It's so great, right? So we're just on the verge. We're actually having another advisory board meeting next week. I just met with Maddie Arasich from the building trades, and we'll begin, what are going to be the first few on the island, and then a little further west into Queens.
Pretty cool.
Yeah, amazing, right?
Yeah, the world of advanced primary care is is changing the way healthcare is looked at today. So we know that this is coming. This is not going away.
No.
Now that these programs and companies like yourself are in place,
Yeah.
this is the way the way of the future.
Yeah.
To drive down costs and then just provide better care. I mean, everybody's doing things to not provide worse care or worse services, but try to enhance them.
Yeah.
And what you guys are doing some incredible work.
And, even though it's new to the building trades here on the East Coast, this is not a new, we have almost 10 years of experience in knowing that this works, that it provides better care, that it provides better wellness, and that it saves the funds money. So even though it's new to us, it's not a new concept, right?
Oh,
It's been around for almost 10 years as far
as
as the advanced primary care goes.
Absolutely. I got to go. So legacy and advice. So when you look ahead, what legacy do you hope your work leaves with the next generation of union members and their families? I know we probably talked about it before, but you are leaving a legacy. I mean, if you're putting this into place, this is something that hasn't been done in our area before.
Right.
So this is something that you will also have as a legacy when you move into it.
So I'm happy to say that I'm hoping that my children and my grandchildren, and that my my work associates and everybody in labor is able to say, you know what, because of what the work that we did here now on the East Coast and throughout the country for labor, our kids have never known a struggle with healthcare.
Right.
That we've been able to provide this for them, where just like, they don't know what it's like to dial a phone or any of those things that we did, that they won't know that there was a problem with healthcare, that there was a healthcare crisis in the United States, that they had to wait a month before they could see a doctor, that they were talking to a stranger, that they had their own doctor, they had their own place where they could go, they had the best care available to them with people who care, and at a cost that wasn't breaking the bank, making them broke.
Right. Couple follow-up questions as well. What advice would you give a young person growing up in the union household today?
Go to work. No, get up, go to apprentice school, listen to the journeyman, learn from the journeyman. You might have to take a little abuse, but you're going to be okay. I promise, But really learn about union. Learn about what it means to be a union member. Go to your union meeting.
Right.
Be involved. Show up. Be a proud union member. Make sure that all the work and literal blood that was spilled for you to be able to have this union and have these benefits, have this pension, all of these things, learn all you can from the journeyman, and support your union. Go to your union meeting.
Yeah, that I've heard that from multiple people that I've interviewed. Again, it's just getting involved.
Get involved. Learn everything that you can about what it means to be a union member.
Yep.
What it means to organize.
Right.
Learn everything you can about what it means to have a union.
Right. And again, here at the time, it's ingrained in my life over the past 25, 30 years in my career within the labor space. So I've been so fortunate to meet people, one like yourself too, just going up within my career, and all the labor leaders that I've actually watched progress from business reps to ESTs, to business managers and presidents, and just kind of watch their career path grow, and watch them as leaders, because they're now training the next generation in a different world with technology and working in different ways, and just trying to keep these career opportunities in place. And like I said, the building trades, there's a lack of skilled people, so there's a big, I guess, opportunity to train that next generation
Yeah.
into these particular skill sets, then really showcase the benefits that they have through leadership and organizing programs like Solidaritus, that they're going to get a better quality of life
Yeah.
with their health care, as well as the pay scale that they have as well. So it's just cool.
The other piece, right? So we both grew up in it, and, I didn't know that people don't know about unions, right?
Yeah.
So making sure that people understand. Let's say, for instance, that Starbucks is striking, right? Don't go to Starbucks this week.
Right.
Live without your coffee. Support those workers. Understanding those kind of things. Never cross a picket line.
Yep.
Right? And if someone is striking, give them some support. Give them some help that they need. All of those things, like, people don't understand, like, what happens inside a family if there's a strike. Like, a strike is the last thing that a union wants to have to do, right? Because it creates hardship. But it's that power, and that's where Solidaritus comes in, right? We have all this unity with the coalition, with all of these things. It's that power of that solidarity that is able to create the opportunity for this type of healthcare, for you to be able to put your kid through college or provide a better life for them. So all of these things, but really understanding what a union is and how it helps and how it builds the middle class, and how there's a lot of forces in this world that do not want unions. And if they were not so powerful and they were not so good for the general public and the worker, there wouldn't be so much opposition to them.
Right. No, I hear. I gotcha. I just, in my world today, from an educational standpoint, it's training the younger generation to understand these particular values, so it's not ingrained after the fact or later in life as you grow up. In today's world, too, everybody's on their social media, campaigns that working, but I'm watching a whole evolution of skilled tradespeople showcasing their work and their jobs and how cool these professions are, and the money that they can make.
Yeah.
And then the connections that you have, too. I mean, because, again, we've talked about this is family. You're building stronger bonds and ties with people, working on job sites together and building something that will be there for the test of time. It's just really cool stuff. So,
talk about, what it all means to us. Like, I have a china cabinet in my dining room, right? And I think I actually showed it to you guys maybe when you were over at the house that day. Some people have their crystal and all this stuff. I have my father's hard hat from the Trade Center in my, in my china closet. Like, that's what's important. Like, this is our legacy. That's what's important to us. So, not everybody has that, right?
Absolutely not. No.
Not everybody has an old hard hat in the china closet.
No, and the tools and everything else.
Yes, of course. For the eclipse, I had his old welding mask on. People were laughing at me. I have pictures of it. I had his old welding mask on, and I'm watching the eclipse. People were like, "Is she crazy?"
It's like, no, I'm smart, and I got all this
stuff. Where did she get
stuff.
that from?
This is cool.
Yeah.
That's great.
So all of those things, are so important. And, I feel blessed. And, my father's passed on. My uncles have passed on. My cousin is still here. But, just being able to be a part of this feels like such an honor, to be able to carry on what they started and to be able to be here for hopefully the next generation and moving forward.
Yeah. No, we are blessed to be in the position and to work with a lot of really inspiring, hardworking people that you could learn from.
Yeah.
And, again, in the course of our careers and where we are today, it's just giving back to those people that have helped us along the way.
Yeah.
And just educating the next generation of what these benefits and values are, and the programs that are supporting labor as a whole. So I'm very fortunate to be in the position I am today as well, and I'm so thankful for sponsors like Solidaritus and friends like you and all these different organizations and a nonprofit that really runs in tandem with labor to provide these services, showcase them, our Vets for Vets program with the Veterans
Love that.
program.
Amazing.
And then these pre-apprenticeship opportunities working with the DOE to really get them the education and skill set. And I love it because you're seeing these young boys and girls and young men and women just learning this stuff and then seeing their excitement. It's just the coolest thing. And again, I wish I could do it all over again. Now it's just time for me to highlight, showcase, and promote these opportunities
You know
the best I
what?
can.
You do an amazing job. And you talking about this, like, even though we're not in the trades ourselves, there's also a community of us that work with the trades that are all very close, and all work with each other and support each other. And, hey, what do you need? And what do you need? And how can we help move this forward? Or what support do the trades need in this area? And we have our own little community as well.
Yeah, absolutely.
And we all work together. Like there's really not competition in our world, right? We all work together for the good of the whole.
Yeah, I think everybody plays a role. And for me, the privilege I've had in the banking and finance world, the dollar touches everything.
Yes.
And if you have the personality and you can grind through, these long sales cycles and trying to, get yourself a piece of business, or saying, these are my clients, these are the people that I work for. You're always there to help and support them. But again, if you're in a business, you got to bring in the business, to pay the bills.
Yes.
In my role now, I just feel like an educator and just, learning about programs like, advanced primary care and all these different programs through technology that are enhancing people's lives. I'm like a kid in a candy store. I'm just like learning and a sponge every day.
Yeah.
And to be able to have a platform like this to start to really, push the agenda and hopefully inspire that next generation is I'm just very fortunate to be in the role that I am today, and thankful to the sponsors that have supported us.
Well, one of the plus sides, of course, being in sales, right? I'm in the sales part of the company, and being owned by labor, they understand that it's not going to happen tomorrow, right?
Yeah.
But that the trades are responsible, right? This is their members' funds. This is their members' money. This is their members' blood, sweat, and tears, literally. And they are responsible for how this money is used, right? And so understanding how it works, understanding that it doesn't happen overnight, and that there needs to be a certain level of trust as far as that goes. And they have a fiduciary responsibility to make sure. So being a part of Solidaritus, the company knows that because it's labor. It's labor.
Yeah, exactly.
Right. So, yeah.
Really, really cool stuff.
Yeah.
Again, Mary, I just want to thank you for everything, that you do.
Thank you.
Your career and your, the life that you've lived in the labor space.
Thank you.
Learned a lot from you, and
Same.
We're making a difference in what we do. So
Yeah.
Well, as we wrap up, again, I just want to thank you for your leadership, your dedication to union families, and the work you're doing to better build a better healthcare system for working people across the country. To our audience, if today's conversation resonates with you, learn more about Solidaritus at solidaritus.com and connect with Mary Fogarty on LinkedIn. This is the Union Labor Advisory Network, supporting, educating, and promoting union labor and our communities one story at a time. I'm Mike Fina, and we'll see you next time on the next episode. So again, I want to thank you for everything, Mary.
Thank
Appreciate
you,
it.
Mike.
Thank you, folks. Follow, like, and subscribe to ULA Network. Thank you. I'd like to thank all our sponsors for helping to build and promote the ULA Network. It is because of you that we're able to support, educate, and promote informative content relevant to labor. Please subscribe, like, and share our channel and media. I'd like to thank you all for your support.